So when you're dealing with your suture scissors, there's a variety of different types that you can encounter. The best way to use these is to put your ring finger, thumb, okay, like so, and then your index finger, okay, right around the fulcrum here. And then when if you have to use it to debride, you can see you can use it vertically like this, okay, along the wound edge to cut tissue. This pig's skin is pretty rough, so it's going to be difficult to do that. But anyway, you can use it to cut sort of along the edges to get rid of the jagged edges. Okay. When you're cutting sutures, typically what I do is I lift up on the suture, and I always have my finger right over the fulcrum here, and then I go right above the knot, and then just sort of, and I'll show you this when we put some stitches in. I sort of verticalize the suture just above the knot and cut. Okay, so that's sort of the way to do it, but always good to have your finger here. The other thing is, if you need to do any cutting, you can always use your other hand to position the scissors as well, you know, just for support. Probably the most important tool of the trade is the needle driver. Okay, the needle driver, it has 3 clicks if you listen. Okay, that's locked. Okay, 3 clicks is locked. And you really don't need to have your fingers in the holes. However, if you do, you should never have a thumb and index finger in the hole, okay? Never thumb and ring finger, or middle finger, excuse me. That's not the ring finger, the middle finger. You know, that's a little bit safer, but you just don't have much control over the instrument this way. Really, the best way to do it is, if you're going to have any fingers in the holes of the instrument, is your thumb and your thumb and your ring finger. Okay, that's the best way. Okay, as you've learned in the labs, once you get used to the instrument, you can just palm it like this, and then use your thenar. You see what I just did? I put my fingers down on this side, and I just lifted it off with my thenar. Okay, my thenar muscle, that's locked. Now it's unlocked, and then so you can just use it and reach over and grab and just lock it and then unlock it just with your thenar muscle. And when I do that, you'll see with my fingers I grab the other side of the instrument. I just sort of put some pressure on it so I can get that pull down on this side, pull up on this, pull outward on this side. So they have to go in opposite directions, okay, to open and close like that. See? So anyway, very easy. But bottom line is this, right? It's like anything new. If you're going to use these instruments, and you're going to be seen doing this, doing these procedures, suturing on human beings as a student, make sure you use the instruments right. Okay, don't think, well, I'm just going to do it the way I want to. I don't care if Adson says to hold his forceps like a pencil. I'm going to use it like this. Make sure that the preceptors see you using the instruments the way they're meant to be used, right? And they will gain more trust in your abilities if they see you doing it the way, the proper way. Okay, but it's like anything. It's like when you started using the ophthalmoscope. You had a difficult time at the beginning trying to get your eyes adjusted to the scope, and then looking into some of your fellow students' eyes, and then switching to the other eye. Right? Well, after a few weeks or a month of trying it, it became second nature. It's the same thing with these instruments. Once you use how to use them properly, it makes the repair that you do much better. So make sure that you focus on using the instruments properly.